session, as I said, is on writing health information everyone can understand. And I'm C. I'm presenting today as the Health Literacy Officer at the Healthcare Consumers Association. Before we get started, I'd like to acknowledge the traditional owners and custodians of the land that we're meeting on. So for many of us that's here in Canberra, the Ngunnawal and Ngambri lands, and acknowledge pay my respects to their continuing culture and the contribution they make to the life of this city and this region, and pay my respect to their elders past and present. So, and of course, acknowledge any Aboriginal and Torres Strait Islander people attending here today. Just a little bit of background for those of you who might not know about the Healthcare Consumers Association. So we're the peak body for healthcare consumers in the ACT. So that's people who use the health system, which is in reality all of us. And we speak up for people who use healthcare and work with the health system to make it more responsive to what people need. And this talk is really all about what we've learned about producing good health information for people who are in the health system. And a lot of it's built on experience from handouts that have come to us or letters that we've seen that could have been written in a better way to start with. So we're trying to share some of that knowledge here, and you might have experiences that you can share in the chat with other people, and learning from each other can be really helpful. All right. So to kick us off, we're going to start with why plain language is important and a bit about what I mean by plain language. We're talking about writing health information in plain language rather than something like easy English or easy read. So this is for a general audience, people, all Australian adults really. We want to write plain language so it can be understood by as many people as possible, and that makes it easier for us to adapt things into other formats. And it's really important for a number of reasons in healthcare. So to start with, of Australian adults, and these stats are straight from the federal government, 44% of Australian adults read below a grade 10 level and 14% below a grade 6 level. So it's quite a lot of people whose reading level isn't quite up to snuff. And some reviews of health information that's out there suggest that most health information is published at grade 12 or higher. So you can see that the information we're providing isn't actually meeting the literacy levels of people in terms of how they read. And we also know from the Bureau of Statistics that about 60% of people Australia-wide, or 44% in the ACT, of people have a level of health literacy that's low enough that they would have trouble doing everyday tasks in healthcare. So that's finding a service, that's booking appointments, that's taking medications correctly. And literacy and health literacy are quite strongly linked. So providing plain health information is really important for making sure that people's health literacy levels are supported. When I'm talking about plain language, it's health information that is simple and clear, it's actionable, so it's clear what people need to do, and it's relevant to the reader. So when we're writing for a general audience, it can be a little hard to know what's relevant, and we may need to trim back or provide more information. We might need to tailor things for different audiences. That's particularly important when we're thinking about people from different backgrounds and with those different levels of information needs. The relevance to the reader is really important. However, plain language is not dumbed down. You might simplify the information, you might target it to groups, but you're not dumbing it down so that they're not getting enough information. And one thing to remember is that we as people in the health system, even as someone who's on the advocacy side of things, often don't realize how complicated the information we're sharing is, and it's a hard thing that you really need to practice. So I find myself using acronyms and jargon from the health sector because I work in it every day, and sometimes you have to consciously catch it. So practice is really important here, and it takes skill and awareness to create plain language information. It's not something you can just expect that you'll be able to do without practice. It's important to say here that plain language is essential to safe healthcare because people need information that is simpler and more actionable to them. And people can't consent or follow treatment advice if they don't understand it. So If you are providing safe healthcare, that involves providing plain language information so people understand what is happening to them, what they need to do, and whether they can give consent, how they can give consent, all of that. So when we're talking about plain language, it's not just a nice bonus. All the information we're providing needs to be in plain language. Otherwise, we're not providing safe healthcare. So the first step in getting to some plain language resources is knowing your audience. So uh, what we start with is asking ourselves, well, who am I writing for? Who is the audience? It could be the people who are using a particular service. I'm writing a resource for people to be handed in an appointment. It could be that we are writing for the general public. It could be that we're writing for a particular cultural group in our community that needs this information particularly. It could be that we're writing for, say, new parents, so people who are experiencing a high level of stress, or it could be younger people. And of course, the literacy of younger people might be low because they're still learning. Um, so you'll also think about what do they already know? And if you don't know uh, what people already know, that's a signal that it might be a good idea to start talking to people early. So you could connect with a community organisation that works with the community you're targeting. Certainly, we work with the Multicultural Hub of Canberra when we're talking about multicultural health issues, and they can give a lot of expertise. Or you can come and chat to us at HCCA about, well, how do I work with consumers in this group to understand their information needs? But it may be that these are people in your waiting room every day that you could talk to a few people about, well, what information isn't clear to you? What could help? You also want to think about what format will work best for them, because the way you write might be influenced by how much space you have, whether it goes online or whether it's in print. And thinking about that format can be really important at the start, because you might be giving people a lot of online links, but if you're handing out a paper resource, that's not the best strategy to take. And paper is still really relevant. We're living in an increasingly digital world, but one of the biggest information gaps we see is in people who still need paper resources because they're either not very tech literate or there are affordability barriers to using tech. You might also look at what information already exists. There are a lot of really good, simple, well-tested resources all around the country. They might be able to be adapted to the ACT. And if we're not reinventing the wheel each time, then it's less difficult for consumers to go, oh, well, I've got these two fact sheets about, say, gout in front of me. Which one is the right one? Whereas if we use the same one because it's relevant and contains the same information across services, then we're not duplicating the effort and we're creating less confusion and overwhelm. So have a look at what resources are already available and whether you could use those. It's also important to think about the diversity of the groups you're talking to. So things like age, culture, gender, disability could influence the way that people are understanding your message. So there might be certain cultural perceptions around certain topics that you need to think about. It could be that you're talking to older people who have some cognitive issues, so you might need to simplify it further or consider something like easy English to support people with disability. It could be that you are talking to a group around gendered health issues or sexual health issues, for example, where you want to be careful about not excluding people because you're making assumptions around, say, the gender they might identify with. And all of these things can change how someone understands and applies information. If they don't see themselves on the page, you're not using terms that tell them that this information is about you, then they might not realize that the information you're sharing is relevant. And you may want to work out if you need to do translations quite early, because you'll need to do things like consult on cultural sensitivity. Plain English is really useful. If you've written something in plain language, it can be easy to do a translation, but direct translation isn't always a good thing. So before you translate, if you're going to, you need to make sure your message is culturally relevant, and that's where you might consult early. And understand that some health concepts might be different between cultures, so you might need to come up with some new language that's more relevant. So the way that groups describe mental health can really vary between cultures, and user testing is really important when you're talking about things like mental health, and certainly in spaces like death and dying, because the way that people talk about it is very different, and just having simple, plain language might not make it relevant for people. All right. The other thing to say here is that this talk's a bit misnamed. I've called it writing health information everyone can understand, but not everyone can use written information. So you might need to think about other formats that could either reinforce what you're already putting out or provide the information in a way that is useful for other people. So that could be videos and doing a simple explainer. It could be very similar content, but someone sitting down and talking about this is how you access our service. And I know that Canberra Health Services has been putting more stuff on their social media explaining about different services they offer. That could be a strategy. It could be that you're working with a lot of people who use Auslan, so getting an Auslan translation done in video could be helpful, but even something like a podcast. And if you've got a really good plain language resource, then doing a short audio piece could be quite straightforward for you. And that conversation is another way that can really help people understand the message. So think a bit more broadly than just written language. So now that we know our audience, who we're writing for, and we've got our topics in mind, we want to make our message clear. And there's a few key things you can do to make that message really clear. It starts with what I was talking about earlier around making things actionable. So you want to start with putting the most important information first. You want the key bits, and that might be contact details for how you get referred into a service. It could be, here's a warning sign about your condition you need to look for. You will know best what you think is the kind of key important information that people need to know, and pop that first. Don't bury it in the background. I think a lot of us come from academic backgrounds or different training where we're used to starting with background. That's not always relevant when we're doing consumer information. You want to try and leave out non-essential information. We don't need all the background to a condition to understand what we need to do, but it is good to include a bit of the why you need to do this. So that kind of gives people the motivation to follow through. So you might be talking about, say, looking after a wound after surgery. So you could say something like, you should keep your wound clean so it doesn't get infected. You've given me the why, I don't want it to get infected, but you've said clearly what I need to do. I don't need to know, for example, all the different kinds of infections I could get, and that would really bury the important info. Another thing you can do to make information sort of, oh, you're talking to me, this is relevant to me, I am someone who needs to do something, is to use the word you for the person who is reading it and refer to the service as we. You sometimes need to be a little more specific if there's multiple staff that people might need to talk to, but saying the service is we means that we're the ones that are looking after you. If you need help, talk to us. And that helps that sink in, but also saying you means that people know this is an action they need to take really specifically. When you're talking about the actions, focus on the action we need to take. Be specific. So terms like if needed can be a bit confusing if you haven't given us any elaboration on when might this be needed? How will I know? So tell me when my doctor might consider medication if lifestyle changes haven't worked in my treatment course. So you're giving me a bit of information about when that decision would be made. That makes that, if needed, less ambiguous. And use active voice. And I'll show you what active voice is because it's a grammar concept that we're not always well taught. So a passive sentence is something like medication should be taken twice a day. And okay, my medication might need to be taken twice a day, but how do I know that I'm the one who needs to administer that? So saying you should take your medication twice a day makes it an action that I am taking. It's still quite a short sentence, but it just adds that. And then I've got a bit of a longer passage here so it's important that wounds are monitored for signs of infection, such as swelling, redness, heat, and discharge from the wounds. Any infection should be escalated to a health professional. That is quite a bit of a block of text for a fairly simple instruction. And saying any infection should be escalated to a health professional. Well, who's escalating it? Am I waiting for someone to notice and they'll escalate it for me? And monitoring for signs of infection, who is doing that? If it's my responsibility or someone who is looking after me, I need to know that so that it's really clear who needs to take that action. So I've rearranged that section to say you should contact your doctor if the area looks red or swollen, feels hot to the touch, leaks fluid or pus. This could mean you have an infection. So you should contact your doctor. That's the action I need to take. You're telling me when, so really specific criteria about what an infection might look like. And then you've said, this could mean you have an infection. Here is the why. This is why it's important. You need to act. So that's a clear way of just rearranging that paragraph so that it's actionable for people. All right. There's some other things you can do that make the information more useful for us in terms of participating in healthcare. So one thing that a lot of people like is helping us to ask good questions as consumers. So you could include a questions to ask section, especially if you're writing for a general audience. You won't be able to give tailored information for everyone who will possibly be using that, but including a questions to ask about which includes things like what medication will I need to take? So you include a bit of information there, or just tell people, ask your doctor about the medication you might need to take, or ask your doctor about what side effects you might need to know about, or ask about what other health professionals you would need to see. Referral processes and managing all of that can be quite confusing, particularly if we're talking about a new diagnosis. So giving us those questions is, I'm going into my appointment with a list of questions for me to follow up on. And that's a really good piece of guidance that enables people to participate in their healthcare. You can also include contacts and links for more information. So certainly if it's digital, include links, could include QR codes and some ideas of where people can go for more. That way you're not cramming in all the extra background to what we'd like to keep a short and to the point sort of handout. And one thing that we've seen some services doing that's quite good is that if a handout is being used in appointments, is to leave a space prompting the health worker to pop in their contact details or how to contact the team. And that way, while they're explaining the information on that health sheet, it's also, and if you have more questions, this is the person to contact. So you're enabling us to take some proactive actions to look after our health. Just a point on links is if you're putting something in a digital format, try and use descriptive text for your link rather than doing something like click here, because we're often skimming and looking for like that blue color with an underline, and we know that's a link. So if we're skim reading and it says something like some recipes for healthy meals, I know that's a link where I can go to get those recipes. Whereas if I'm skimming, click here, doesn't jump out at me. It's also better for people who are using screen readers. So having the text read aloud, the way that the screen readers read those will be easier for people to follow if it actually says what the link is. We also really need to try and use everyday language, and that can be really hard if you're used to using certain terms. And this is where some audience testing can be helpful. And we'll also share some links in the email afterwards to some lists of words that you might swap. Some that we see are things like using cardiac, where you could say heart, using pediatric, where you could say children. For something like acute, that could mean something different in different contexts. It could be more like urgent or sudden, and simplifying that so it's more the language people use in their everyday lives can be helpful. With acronyms, using something like ED rather than emergency department can be confusing. So if you're only using an acronym a few times in a document, just spell it out rather than including the acronym. If it's a longer document, you might need to spell it out the first time and make sure that people have that definition. There's also some words that are a little longer unnecessarily, like utilize when you could say use, that especially if someone's like learning English, it just adds an extra layer of confusion. So if a simpler word will do, go for that. And all of this is also to say that sometimes we have to use complex medical terms, and it's an opportunity to teach people those terms. So if you find people have to know this word because it's used really commonly when talking about this disease, or I find that the word referral can trip up some people who aren't used to the Australian health system. So stopping and actually explaining what a referral is means that in future, whenever people see that word, they've got that. So if you have to use a longer term, define it. And for longer documents, you could even include a glossary, which would be really helpful for people. All right. These are just some common sort of pitfalls that we come across quite often when we get handouts from people. Using subjective terms, so something like do moderate intensity exercise. Not everyone knows what moderate intensity exercise means, and it's probably more useful practically to tell people something more descriptive, like exercise that makes you breathe harder, but you can still have a conversation. That's quite clear about what we mean. Another one is being too casual. Sometimes we want to write things in everyday language. We go a bit too far and start using like idioms. So clean bill of health is one of those idioms that pops up that's, well, clean bill of health, is that related to payment? I'm not sure. And pitfall is actually a pitfall here. Using that word assumes that people have the context for it. It's not a word that people are often learning when they're first learning English. So it'd be better for me to say something like mistake here. And using language that's too casual sometimes results in extra words. So trying to keep things simple and to the point means that it might seem a bit more abrupt than casual, but it's more important to be clear than necessarily really conversational. We want to not avoid sensitive words or topics. Dancing around those topics can be really confusing, particularly in sexual health. We see a lot of euphemisms used, and that's not necessarily helpful. Whilst there are sensitivities there, it's better to be really frank and frame things honestly but positively. A really common example is using the word stool instead of poo. And so I've got here a picture of a smooth rounded stool, and if you take the literal meaning, it's about a 3 to a 4 on the Bristol stool chart, but that's probably not very helpful if someone's asking you questions about constipation. So try to use honest language rather than using euphemisms, and you may want to test with your audience if you're worried about sensitivity. So we've made our message actionable and we're working on making it relevant. Making it easy to read is the next step. And this is where we might be editing our sentences down so they're straightforward. So the key principles here are keeping the sentences short, 20 words or less is the ideal. Paragraphs, no more than 5 sentences. If you're going more than that, you probably need to split it into 2. Use shorter words. So less than 3 syllables is ideal. If it's over 3 syllables, that's a hint that you might need to define that word for you. And when you've got a list of 4 or more things, that can make it really hard to read a long paragraph. So use dot point lists of 4 or more. And that also tells people that this is a list, which isn't always clear if we're given clauses and commas and all of that sort of more complex grammar. And if you follow those tips, generally your reading level will come out at about a grade 7 to 8, which is pretty good. You also want to be really consistent with your word choice. There's some terms that have a bunch of different ways you could apply, like say what you mean. So for instructions for eardrops, for example, don't say instill in one place and apply in another and use in another. Try and use the same language the whole way through so it's clear that this is the same action we're talking about. It's attempting not to be repetitive, but pulling out the thesaurus can sometimes overcomplicate things unnecessarily. One example that we've got is I've grabbed this from an academic paper on tendonitis that was actually included as a link in a fact sheet that I got once. Chronic tendon problems are common in orthopedic patients. Relatively little is known about the etiology of these common problems and the efficacy of available treatments. So this comes out at about a grade 12 reading level. There's several words in there that might not be well known unless you've got an academic background. But you can rewrite it and keep the meaning of this passage by saying long-term tendon problems are common in patients with other joint problems. We don't know much about what causes them or how helpful the treatments are. So that has conserved the information there, but simplified it so it's easy to read and anyone could access it. Now it's your turn. I've got this little passage from some work we did earlier in the year, which is constipation can usually be treated with a combination of diet changes, good toilet habits, stool softeners, or medication if needed. So I'm going to ask you to pop in the chat how one thing you might change about this to make it more readable. If you're really brave, feel free to try and rewrite the whole thing. And I'll give you a couple of minutes to do that, and then we can kind of talk, compare notes, and see what people suggest. So yeah, we've got Mike saying, yeah, you can treat constipation with, so making it a you statement. Using a bullet list because there's 4 items, yeah, making it clear that there's a list here. It's not just one long sentence. Yeah, if you're finding it hard to do a poo, you could try these things. Yep. So you've made that really simple and actionable there, Janine.
That's a good one. I like that.
Yeah. No, don't lose stool, use a list. Is if anyone's brave enough to put their hand up and speak out, happy to have a chat about it.
Any takers?
I think even the lists of treatment need to be simplified because diet changes is a huge option. And if you start writing different food changes, then what is that as well?
Yeah, absolutely. So some of these are a bit vague. What do you mean by diet changes? And it could be, depending on the context, that you might need to say diet changes that you would start with a nutritionist. Like, depending on where this is being used, it might be a bit more information about, well, who's going to tell me about those diet changes if it comes to that?
You know, one thing for stool softeners would not be to put a cushion on your chair. It would be taking some medicine that makes it easier to pass your poo, or toilet habits is when and how you would sit on the toilet.
Yeah. Yeah. So clarifying, yeah, and we've got someone in the chat as well pointing out that good toilet habits, what does that mean? Being specific about what we mean by good toilet habits. It's also that, like, using the word good could be a bit judgmental to people. It's well, so I'm doing something wrong, and that might not be the case. All right. Yeah, and Lorraine's put in, don't ignore if you want to go for a poo. So we're elaborating on what we mean by good toilet habits. Yep. Links to other things. So certainly if this is an online resource, that could be really helpful for people. Yeah. All right. So yeah, you've got most of the points that we said. I think one of the ones that I'd also noticed was explaining why or when medication would be needed. So when is that decision made? Is it if these things don't work? Because otherwise people might be thinking, oh, we jump to medication straight away. So good idea to elaborate on that if needed as well. But otherwise, you've covered off putting things into dot points, making these you statements, and taking out that sort of vague language. So excellent. Thank you. So we've now got a message that is clear, it's actionable, it's easy to read. You've done some work to get your message right, but we don't want to ruin that by having a layout or a format that's really confusing or cramped. So there are some principles that can make the format of your document much better. So for formatting, it's a good idea to use a simple font like Arial or Calibri, those sort of sans serif fonts. The serifs are a little kick on the edge of letters that you get with things like Times New Roman or Georgia, and those aren't always the easiest to read, particularly if they're at a smaller size. You want to use a font size of 12 or more for printed materials. We get quite a lot that are smaller to cram in all the information, but if people can't read it, that's quite a challenge. And even bigger if you're considering an audience that might have vision issues, certainly for older people. Oh, and yes, you will get sent a copy of this presentation. You can put important things in bold to make them stand out. A lot of people will skim read, and I'll show you an example in a minute where it's used really effectively, but there might be keywords that you want to stand out. That could also be things like phone numbers, popping those in bold, and that way if someone's reading quickly, then they'll be able to find that information. So I've got down there, this text is easier to read, and that easier to read stands out in bold. Try not to use italics so much in long bits of text because they can, depending on the font you use, get a little hard to read. And you can also do things like using headings to group information. One of the things that we find helpful is using questions as your headings, like common questions that people will ask, because that way, as people are doing that skim reading, they'll find the answer to their question. So you're writing a fact sheet about osteoporosis, you could start with, well, what is osteoporosis? So if that's the person's question, they go straight to it. But if they already know and they just want to know about the treatments, then a paragraph that's what treatments are available, that could be helpful as they're just running through that document. So that's one strategy to take we find quite helpful. If you're using a layout that's something like a trifold brochure, it's really important to keep that information simple because we need a layout that makes it clear which order to read each section, if that's important. Sometimes when we're doing those like trifold 3-page brochures, we've got a lot of information that's going across the folds and it's not clear which way to read it, particularly if someone's coming from a language where they read in a different direction. So we read left to right, some people read right to left, and those can be really hard to figure out. So if you're putting in a lot of information, that might not be the best format. A booklet might be better, and certainly anything more than a few pages, number those pages so it's clear what order people need to read things in. The other thing is to leave white space. Yes, we want to keep things short, but we don't want to keep things short and small at the cost of giving us enough space to read the information legibly. I was at a talk a few weeks ago with someone who's talking about doing easy English, and they remind us that white space is thinking space. It's space for people to digest that information chunk by chunk. So make sure that you're not cramming it all in. That's also really important if you're using images. So using things like diagrams to reinforce your text, drawings and photos can be really, really helpful because it draws attention to the key pieces of information, the anatomy people might need to know. So think about using diagrams, but again, you want to make sure that there's enough space for those and it's not making it harder to read the text. You could also use colors. So color code can be helpful to help people process information. But if you're doing that, make sure it's contrasting colors. So making sure that you can read from a distance, whether that text is light enough on a dark background or dark enough on a light background. And there are some color testing websites online because of the web accessibility standards. So if you just put in a contrast tester in Google, they'll come up with a bunch of free tools that you can put in the colors you're using and see if it'll be legible. You can also use icons and graphics to break up text. So just a little like pill bottle to say this is the section on medication. That also helps people, but try not to use so many that it breaks things up. And I'll open this up in a moment, but this example below from a poster is quite a good example of how just a simple little icon is reinforcing the message and breaking down what we're saying. So I'll just switch to that tab. Here we go. Oh, this one. So this is a poster from Health Direct that I quite like as an example of a good layout. There's enough space for things. You can see the heading's quite big, so from a distance, people can see what it's about. But it also follows a lot of those principles of writing that I've talked about. So they say your GP, but we don't want to assume that people know the Australian health system. So they've explained general practitioner or family doctor. So people have now learned a new term that's used really commonly, and it's usually the first person you go to for a health issue. So they provide that information really simply and in a way that people understand in their lives. Then they've broken down all these little dot points that could have been a list, but they've broken them down with images so that it's easy for people to go, oh, well, I'm thinking about immunizations. I can see a picture of a needle. Yep, it's immunizations. And then they have a section that's got, here's where you can find more information really clearly. So as a poster, this is a good example of what we're shooting for with formatting. Another example that I quite like, that's if I can get to it, there we go, is this fact sheet about gout, which we've also shared in the chat. And this fact sheet uses, again, a lot of the principles I was just talking about. So using questions as your headings. So if I'm skim reading, what is gout? Well, I might already know something about that. I might already have been told, and I more want to know, well, how do I know if I have gout? So I can jump to this section just by looking at those titles. It might be a bit hard for you to read, so this is in the chat, but they also do things like explain those medical terms you might need to know if you're someone with gout. So they're talking down here about tophi, which are solid, painless lumps that form. And they've explained what that term is, when it might come up. So people have now learned a bit of knowledge that might come up in their treatment. They've also got a good diagram here. You can see they've only got 3 little bits of text pointing things out. So there's not tons of information here, but it's enough for people to understand, well, here's the anatomy of a joint, and this is where the crystals are forming. That's why my joints hurt. So that's quite a good, simple use of that. And then as we go to the second page, when I talked earlier about putting information in bold that's really relevant, they've got this section on what can trigger a flare. And if you read through this, it's got a bit of context information, but the key words of what actually triggers the flare, which is things like alcohol, fructose, dehydration, rapid weight loss, those jump out at the page. So if you're skim reading, you'll get that information. And then when we get into what can I expect, they've got numbers to tell people that these are the steps in which this might happen. That gives people some time ideas, some process ideas. They've bolded the most important bits of each sentence of what you need to do, and they've included some icons to supplement that. And it's, again, a bit small on this screen, but they've got, for more information, links that are, in this case, they've typed them all out because this might be printed, and that's how you might change your format between electronic and printing, so that people have some ways to ask more questions if not everything's answered here. So that follows quite a few of the principles and might be a good example for you. We want to also make our information as accessible as possible. So for electronic documents, things that go on a website, are emailed to people, there are a few things we can do if we're, say, writing it up in Word that make it easier for people who are using things like screen readers or that are processing information in a different way. So things like screen readers really trip up on tables if they're too complicated. So avoid using tables if you can, and if you are using them, keep them really simple and sort of so they can be read left to right, or that it's really clear what the headings are. You might also use the inbuilt read function in Word to read out your table to see which way it's going, because otherwise it might start reading the columns and rows in a way you don't expect, and then the information loses all meaning. So be a bit careful around those, and certainly don't use split or merged tables if this is a document going out generally, because those aren't read by a screen readers well at all. In most word processing and as well on websites, you can use heading styles to structure information, and the way that those are read by electronic processing, and even by the way Google pulls up search results, is it looks for headings. So using heading styles to structure your information tells them which sections are which, rather than just providing all the text, and that makes it easy for people to jump to the section that's relevant to them. If you're using images, add alternative text to them. And thankfully these days this can all be done in Word, but alternative text is just a simple description of the image and the important information from it. If the image is not conveying any important information, you might just mark it as decorative so that people know they're not missing something from that information. And try not to put really important information in headers or footers because screen readers and other software just skip those entirely. In terms of like other resources, not just electronic, you might consider translating things into easy read if you're working with a lot of people who've got lower literacy, people with intellectual disability or cognitive impairments. And that's a format where they use images and even more simplified language to really break it down. But again, the goal is not to remove much information. It's more about simplifying. And that's aimed easy read at a grade 5 or below, or there's an even more simplified version, Easy English, which is like grade 1. So there's further training you can do to understand those, and it can be useful. Also use more than one format to share the information. So that might be having an electronic and a print version. That might be doing a bit of an audio explainer of some of the information. Try and have more than one format that people can use. Really make sure there's a print version. The amount of times we're not able to get print versions of websites, or they don't print well when we try to get them for people, it's a real barrier for people with lower tech literacy or don't have the technology. And if you are working with people who might be older or might have vision impairment, make sure you just run some off with large print. That's size 18 or over. So it might be that you have a version that hasn't got the full nice graphic formatting, but has the text in larger print for people so that they can read it independently. So those are some options that you can consider. So we've now got a document, we've worked out our accessible formats where we're really getting towards the end game. We want to test what we're doing. So one thing you can do is test your text. And there's a really great tool by the Sydney Health Literacy Lab, which will help you work out things like reading levels. So I will switch to my browser. Okay. So I'll just demonstrate this tool for folks because we send it out a lot, but sometimes it's a bit confusing how to use it. And this is a readability checker. So I've popped in that short bit of text, and you can see the text is coming out at a grade 15, which is very, very high. Because of the way it's been written and the words. So this tool, when you pop in a piece of text, it'll tell you how high the reading level is. You want to aim for that grade 8 or below. It'll tell you which words are longer than 2 syllables that you might want to replace. It's told me that this sentence is quite long because we haven't broken it down. But if you also just hit the check my text, it'll process it and add a bit more useful information. So they've got a thesaurus built in that has words or phrases that might need to be defined for people. So treated, it might be that it's more about give care, taking care of something rather than treated. It could be that combination is quite a long word here, and things like mix. So I'll give you some suggestions there. It also, in pink, highlights uncommon words. So these are words that are generally not familiar to people who are learning English. So we've got constipation, stool softeners, as we talked about earlier. Thankfully, we haven't used any acronyms, but it'll highlight that for you as well, so you can make sure you've broken those down. And it'll highlight passive voice for you. So constipation usually being treated. And as we said earlier, making that sentence more of a you action statement could be more useful. So there's a few ways that we could break this down. So like we talked about earlier, we had putting it into dot points. So if I grab the diet changes, good toilet habits, stool softeners or medication if needed, then that's already broken down that sentence a bit. And you can see our readability has already gotten better. It's now at a grade 10. And one of the suggestions we had in the chat earlier was you can treat constipation with, I'll just grab that. Of course, it wants to misbehave whilst I'm in the middle of this. Okay. So now we've got our readability level down to a grade 7 from a grade 15. We still have that word constipation, which is long, and we may want to define it. And if I check my text again, it'll still have those words that we need to redefine. But you can see how using a tool like this will help us make our work more readable. The thing about readability checkers is they don't check for understanding. They can't do that yet, then they're not that manageable. So you will need to test this for understanding with consumers and other people to make sure that it's actually understandable. So that tool is totally free. You will have access to it, and it's a really good practice, even if you're doing short things, to just throw it in there and make sure you've got that good reading level. All right. For things like format, there's some checklists around, and we'll include this in the emailing out. This is a simple one from Health Literacy Northern New South Wales, and they just have this patient information checklist. They ask you about the reading grade, which is, yep, and Michelle's just popped that in the chat. It'll ask you about the reading grade, which you can use that readability checker to check. It'll ask you about the plain language, but it also goes into all those sort of formatting things that I talked about earlier. So making sure that using a plain font, size 12 or bigger, the information is in bold rather than being capitals or italics, making sure that your information is structured so the purpose of the resource, the actions are all stated at the front, and the main information. So using a checklist like this can help you make sure it's in a pretty good state. So once you've checked your information, then it's time to go and test with consumers. You may have been working with people all along and you go back and test with those people, but it's a good idea to test with a mix of people who might not have been along for the process so that you can make sure that if there's any stumbles, people can find them. So involve consumers as early as possible, but also test with people with a mix of backgrounds and a mix of background information or a mixture of needs. And try to do this early so that you've got time to change things. Sometimes we get things sent to us for consumer review with only a week before they're due, and there isn't time to make the changes that we've asked for. The things that you want to ask about are asking readers to explain key messages back to you to check their understanding. That's a really helpful thing. If there's something people stumble over or that you've had to explain again, or they've come back to you just saying something you've gone, oh, actually, I didn't mean that at all. Checking that understanding can really catch whether you've hit the mark. You want to ask people if it's clear what action they need to take and maybe ask them to tell you, well, what action would you take if you were following these instructions, making sure that that bit's clear. Asking people about whether that layout is easy to follow for them and if there's any changes they'd suggest there. Is it clear where they can get more information? And asking about whether there's enough images and do they make sense? So if you do those 5 things with a few consumers, you should have a pretty good review of your document and what might need to be changed. And we've shared on the Canberra Health Literacy website a few more resources about consumer testing here. And I'll stop for questions now if anyone's got any.
Oh, someone's coming up. I'm just trying to work out. Is anyone having difficulty unmuting, or is that just some background? Instead of starting with a question, I'll start with a story. I was given a flyer the other day that was about diabetes, and I was flicking through and I just sort of opened to the middle page and it was all about gestational diabetes in pregnancy. And the main image on that page was a picture of a man like doing some brisk walking, so there hadn't been that connection that, the image and the topic, like it just totally got lost in the mix there somewhere. And I pointed it out to the person. I said, oh, that's an interesting choice of graphic for pregnancy diabetes. And I'm going to change that for the next one. So like it's even people who are really well versed at doing these things, it's always good to check and check again.
But it is important to make sure things like the images are relevant to people, so that it sort of sinks in that this information is about you. It's applicable to your life. The instructions here are for you, and images can reinforce that message. Absolutely. All right. Not getting any questions. We've covered a lot of ground today, and we will send out the information, but we've also just put up a fact sheet that covers all the essentials we've just talked about and a few more. Michelle's just popped that link in the chat for you, the fact sheet, and also our writing patient information page on the Canberra Health Literacy Hub, which has a lot more expansive information, checklists, tools, and other things that can help you really build your skill in this area. And if you've come across a really helpful resource, then do send it in and we can add it to that page. We're always updating it. I've also just popped in my details as well. If you're looking for people to help you assess a resource, then we might be able to help. So reach out to Healthcare Consumers if you're developing a resource. And some of the folks in the room today are our consumer representatives who will help with that on committees, things like that. So do make sure that you reach out if you need people to review your information. That's one of the key points to making sure these things are actually useful for everyone. So thank you all for joining us today.